Hi y'all, it's Gem here again. Just finished day 2 not that long ago in day 2 level 1 course of immunobiofrequency here in Jersey with the Dr. Perry Nicholson. So I've got to say the amazingness just continues. Really interesting day. So we recapped a lot of the things that we went over yesterday and just the principles and the theories behind, how this works and the possibilities that you can, of the types of injuries and illnesses and just general wellness that you can improve in people. So I guess one of the things that stands out for me again is that, I was kind of quite tired when hey Ishan, how are you, man? I'm here doing a immunobiofrequency course here in Jersey, and I've got to say it's bloody outstanding, mate. Hello, my babe. I can see you there. I figured you might be waiting to pick up Lou. Anywho, so day 2, and I woke up quite tired today because I took off my little patch here, and I put it on, and I thought surely this isn't going to be enough to sort of perk me up. But I've got through the day again, like incredible energy and focus, sitting a lot for the day, or getting up and moving around because we saw patients today. But it's one of those wow factors. It's like usually on a long day, and I'm still getting over jet lag and time zone differences that I'd just be struggling, and I haven't. So if this is how good it's supposed to feel, then hook me up with some more of this. We did a couple of really cool assessments, and I'm with some pretty outstanding practitioners here. Hi, Lovey. Love you too. So some pretty top practitioners here, and everyone's got their specialties or what have you. But what surprises me the most is that there isn't really any McKinsey credentialed clinicians in this area, and I think that's such a shame, especially with some of the things that we saw today. I just wanted to tackle them with the McKinsey approach, particularly if someone had a history of a disc issue in their neck or in their lower back. But at the same time, it was really cool to see the magic of these discs, like seriously. So one guy, in fact, he's a chiropractor that works in the clinic that we're working out of. And so, of course, because one of my passions is SFMA, hey, Mark, how's it going, man? I top tiered SFMA because I'm pretty sure I'm the only practitioner other than Perry that is trained in SFMA. So it was pretty clear straight away that it was probably a cervical origin, or meaning coming from the neck, was contributing to his shoulder problem, and also that his bicep tendon was not sitting well in the groove, and that was really clear on testing. So the big picture, the holistic picture for this guy is that he's got some heart issues. He's got heart disease, high blood pressure, incredible tension through what we call the gut brain. So when we sort of press below your, just above your belly button up towards your rib cage, this guy had so much tension and a lot of pain, and that's a real sign of systemic inflammation because pain... first of all, inflammation begins in the brain, first off, and then if you're inflamed in the gut, then your whole system's inflamed. And the history for this guy, he's probably in his 50s, he talked about having quite a bit of stress. So, and when you look at tension across that front line and through the anterior chain, particularly going from the right side of the hip up through to the left shoulder, he could barely, there was just going to be so much stress along that shoulder girdle complex when he used his arm. So he's got this kind of, bicep tendon problem or whatever. But as I said, it was out of the groove. So SFMA took me there. NKT, which is another one of our amazing methods that we use at Evolve, helped me relocate it. I missed you too, Lenny Lynn. He had a couple of other things going on. I wrote some things down. One of the really obvious things that was going on with this guy is that his shoulder blade was sitting in a protracted position, so kind of more around to the front of the side of the rib cage and sort of tipping up and over. And of course, as anyone who's in the industry knows, this is going to jam up the shoulder a whole heap more, right? So And so he had no power in his upper fiber and middle trap fibers whatsoever, and there was no rhomboid muscle tension going on. Yeah, Mark, yeah, definitely some myofascial sling stuff going on, but I think it was bigger picture for this guy. Like, he's just got some heart issues, he's on some medication and what have you. His whole system's just a mess. He needs a massive detox, man. Anyway, I relocated his bicep tendon in, which is kind of like, well, what made the difference? I'm not entirely sure. Was it that we had put these discs on him that increased blood flow and vascularity to the area, and pain, and we sort of drove the inflammation out from that area, what have you. You can put these discs on that create a distraction through the joint, so perhaps we cleared a little bit of movement, took some pressure off. But, so you could kind of go, well, maybe it's because I relocated the bicep tendon and all of a sudden his power came back on, and we saw things change. But I'll tell you what you couldn't dispute is that when we stuck a disc, like an energy disc, in the middle of his rhomboids, I shit you not, within a split second, these rhomboids fired up. You could see it right before your eyes. Like, it was insane. Hello, Steph. And that, to me, I mean, that's not placebo, and that had nothing to do with what we did, because it was instantaneous. Put this disc on, the rhomboids just went, oh, cool, there we are, and they just we just got tension in there, and the shoulder blade pulled back. So that was massively significant for me as a therapist to watch that, because like I said, I'd done some other things around the area, palpation, all that kind of stuff, and had reset the bicep tendon. So you could argue what was going on there, but you couldn't deny the fact when you set this disc on, this muscle activity just fired up. It was within a split second. Another patient that we saw that was really, really cool, this woman, she's in her early 30s, she's a dancer, she's got a history of, she had her right knee meniscectomy, so a bit of cartilage taken out, but she was complaining of left knee pain on the inside of her knee when she did like a rear lunge or a lunge position or a squat. So again, I led her through an SFMA breakout, because if you're not doing SFMA, man, no, hey Mark, it's called aminobiofrequency. So check them out. The disc material themselves has been around NASA produced the fabric about 20 odd years ago, and it's got carbon fiber in it, so they can load frequencies into it. So it's chemical free, drug free, and there's different discs for different things. So it depends on what you're looking to do, because they've all got different frequencies loaded into them. And you just put them on, and you just, seriously, the things that I've seen through this, I knew it was going to be awesome. I got a nose for this kind of thing, don't you know that by now? Anyway, so I took this chick through an SFMA, because people wanted to kind of jump her up onto the table straight away, and I was like, no, I want to look at some gross movement patterns first. And as I said, I'm probably the only practitioner there other than Perry that's done SFMA. Yeah, dude, check it out, Mark. Anyhow, and I just knew, I was like, man, this isn't a left knee problem at all. In fact, my instinct told me it was a right ankle issue. Now, she doesn't complain of ankle problems. She doesn't have pain. She's never had an injury to it or what have you. So anyway, we get her up onto the table, and sure enough, you could test her through, and she had some imbalances through myofascial slings and all that kind of stuff, because there's a woman on the course who is a highly qualified ART practitioner, so it's an active release technique for those who don't know, and so she's really fantastic with myofascial slings and nerve tracking and all that kind of stuff, and it was quite obvious there was a heap of tension in through the anterior chain, or the front thigh on the right side. Now remember, this is a left knee problem that we're dealing with here. And SFMA took us there as well, but lo and behold, sure enough, the ankle on the right was severely restricted. So poking around there, the left knee wasn't actually all that sore. There was a little bit of restriction in what we call tibial rotation, external and internal, but nothing major. So we kind of got deviated away from there and took down to the right ankle, which we picked up on SFMA again. So if you guys aren't doing SFMA, man, you guys are going to get on this shit. So anyhow, and then as you go further down that right side, the gastroc, so the calf muscle where the soleus and the big power calf connects, and through there was, oh my God, just about hit the roof when we touched that. And if you tracked it further down, the tibial nerve as it hooks around the ankle was just inflamed and really sore. Now, she's not complained of any right-sided problems, remember that. But one of the big things as well that I saw was that the circulation to the right foot tissue was really poor. So when you pushed on it, it took about 8 to 10 seconds for the blood to come back to the area. Now that is a shitty circulation issue. So what we ended up doing was putting some pain discs around to try and reduce pain and inflammation, some discs to improve blood flow, and try and unlock the ankle joint, so try to distract it. Now, there's no you can do manual techniques and therapy with this as well, but for the sake of trying to see what the disc did, we didn't do any of that. So we got her up off the table, and there was a decent enough change, but it wasn't quite right. And I do recall now, actually, what she did talk about was a really tight hamstring at the top, just kind of under her butt where she sits. She's a dancer, so she was really flexible anyway. And when you tested her ankle range of motion in a kneeling position, you could see that the lower leg, the tibia, was externally rotating. And of course, the biceps femoris will do that, or biceps femoris, depending on who you talk to. And so we put a disc sort of in the mid-belly of that, and again, within split seconds, this muscle just let go, and all of a sudden the tibial rotation had disappeared, and she cleared ankle range of motion. And so then, of course, we got her up and got her to do the thing that was causing her left knee pain, and it wasn't there anymore. And what we did, hey JJ, here are the Menobiofrequency, man, you're going to love this stuff. Anyhow, so like I said, we put these energy discs on the hamstring, and we set it up so that it would lengthen it rather than shorten it, and it just took the tension off, and that tibial external rotation disappeared within seconds. Like, this doesn't take 10 minutes to work. Within seconds, this changed it. So it's mind-blowing shit, man. I love it. And probably the last case that was really quite interesting that we did today was this poor dude, and it made me really think about how grateful we are for our healthcare system in New Zealand, and that we do have ACC. It's a double-edged sword, so don't get me wrong. But this man has had like 4 years of back issues and sciatic problems because he's got a disc herniation and yada, yada, yada. But his insurance wouldn't cover his treatment, so he's kind of at a loose end and didn't know what to do. So he came in for this treatment to see what it would do. And again, we top tied SFMAM, and he had some dysfunction in some of his patterns involving the spine, naturally, of course. And there was definitely some neural tension down the left side, and he's got plantar fascia on the left side as well. So if you've ever had that, that's incredibly painful. But if you think about that, that's kind of the end track of that sciatic nerve. So again, no surprise in here. So we got him up on the table and had a look at a few things, and he's got this massive scar from when he was a baby, just sort of on the right side of his sacrum. And he was like, oh, yeah, but that was just when I was a kid, right? Oh, Lynn, make a trip to NYC, babe. I'm here till Monday. My friend Lynn, my mentor, one of my like amazing teachers who inspired me through my movement career, has just told me that I need to help her with her issues. We could make it a business trip, maybe. Anyway, find yourself an ANF practitioner. There isn't anyone in Ontario, but if failing that, go and find yourself a McKinsey clinician. Seriously, when I look back to when I had that major problem back in the Skyline Club when I was competing, and they were treating it as a SIJ issue. It was never an SIJ issue. It was a disc issue. I can look back now, and everything I know, it was a grumpy disc at the time. Anywho, back to what I'm doing here. So this guy has got like sciatic pain. He's had for 4 years, and he's got some plantar fascia or what have you. And if you track that sciatic nerve down, of course it's irritated, and it's often irritated all the way down. And we kind of forget about that, I suppose. when we're looking at things. So again, what I wanted to really do is jump into some McKinsey diagnosis and get this guy on a pathway of like doing whatever his body wants, whether it's extensions or flexion, rotation, whatever it was, because he, hey Petey, and Jan, I know you're there. Anyhow, he had, as I was talking about, the scar that he had when he fell as a baby. And when you move the scar, I kid you not, you could see the change in the motor control through the hamstring. Move the scar one way, the hamstrings are strong. Move the scar the other way, it just went weak. It is pretty cool. So if you have scars, find somebody who knows how to deal with them, because they will shut off and have such a neurological like dysfunction through your system. And again, because it was years ago, no one's ever really paid attention to it. Anywho, so that was significant, and we did deal with that. But you know, there's these, as I said, different kinds of discs. They're loaded with different frequencies or whatever, and you can use different patches on for different purposes, whether you want to increase blood flow, whether you want some vasodilation, whether you want pain and inflammation reduction, whether you want to reduce antioxidants in the area, get rid of the free radicals, and all this kind of stuff. But man, it really does work straight in front of your eyes. Like, it's insane. So it's going to be a really cool tool to bring back to NZ. Anyhow, so thoracolumbar fascia really stuck as well. Just a whole bunch of array of things going on with this guy. So, you know, we got him up, and we put all these discs on him, what have you, and we figured out what we want to do and how we want to treat it, and we got him up, and it could be, I mean, I'm going to be the devil's advocate, because I want to question this stuff, because, you know, I want to find, you know, see what it is and where it works, and I don't jump into everything blindly. So I was looking at it, and so maybe he is, because he was lying on his tummy for a bit, that he got up and he felt better. But he had pain when he started, and even after we put all these discs on, he had a big change of movement. He could pretty much touch his toes, which he couldn't when he started. And the other tests that we did, he had a significant change in his movement patterns, but he still had that pain in the back. And so remember, I was talking about that scar and the big fascial thickening tension tissue that's across the lower back area, called the thoracolumbar fascia, was really, really stuck. Hey, Max and Jenny. Oh, say hi to them. I hope you're having a wine. And then I see my Holly James there. Hey, babe. Hope you're having a good time with Brian's parents. Kitty! Oh my God, this is fun. Anyway, so what we did, remember, so we got him up and he had a change of movement, but his pain was still there, although the pain in his plantar fascia had gone, and his sciatic pain, as you track the nerve along, had disappeared as well, like unbelievable. So we got him back down, and when I first assessed him, I actually decided that there was something going on up behind his neck, and he had a fall, plus his sphenoid bone was out. I love you, Jay, because when you are like a medical doctor, man, yeah, man, we're going to like do something. It'll be awesome. And there's people here, like in New Jersey, they're all saying the same thing. They don't want the medication. And on another note, there's so many people smoking pot here. It's hilarious. It's just, you can walk along and you smell it. It's everywhere. So anyway, so got this guy up, and you can, and remember I was telling you can change energy through the muscles, and you see it like change instantly, whether you want to shorten that muscle or you want to lengthen that muscle. You put these energy patches on, and I saw, like I said, I saw those rhomboids retract and fire up, and there was tone in there, and there just wasn't. You could see the skin had changed around the area. It was just instantaneous. So with this guy, what we did is we put these energy patches on him, and what it did was it actually kind of pulled the muscle tension and almost distracted his spine in an upright direction, and his pain disappeared. Like, seriously. So we walked in, we did all this stuff. I thought, well, you know, I'm going to put my critical brain on. Maybe it's Mackenzie's been lying on his tummy prone or whatever. But when you palpate a nerve and you can stick these discs on, and then you go back and you push on them with the same pressure, even harder, and it's not hurting anymore, you can't beat that stuff. So this is some of the exciting things that happened today. Really, really cool. And if you'd missed it at the start and you don't want to go back and listen to me all over again, this little patch here, I had to take it off last night. because like I had no signs of slowing down. I've been up all day, I'm still jet lagged or whatever, and I've been doing work on the computer, but just huge clarity, massive mental focus, loads of energy, and so I put it back on this morning, but man, I was tired. Same thing, just bounced up, huge focus, and as we were talking about it today, I was like, if this is, I've been struggling with a lot of fatigue personally. This disc here, it's called, they call it mental focus. You stick it on, it changes frequencies and inputs to the optic nerve. Now the optic nerve takes up massive amounts of brain energy, something like 2/3 of it or something ridiculous. So if that's getting fatigued and you're getting inflammation around the area, your whole system's going to be off. So I've been struggling with focusing, energy, sore eyes, just fatigued. I mean, ask Pasquale. I'm coming home complaining, saying I can't do these long days anymore because I'm just absolutely beat. But I've noticed a significant difference, and I'm in a different time zone, and I'm jet lagged as well, and I feel freaking fantastic. So that was day 2. Tomorrow I go on to the next level, and we are really going in through the lymphatic protocol. Which I'm super excited about. Yeah, it is true, babe? I know. I've been like moaning and groaning about how tired I've been, and nothing's changed except for I've got these little disc things on. You kind of forget they're there, and then people ask you why they're there, and then when you tell them what they're for, they're like, oh my God, I need some of that. So yeah, looking forward to being able to bring that home. So tomorrow, hello Heidi, I see you there. So tomorrow, lymphatic system, and if you guys haven't heard about the lymphatic system, seriously, do a bit of Googling around. Dr. Perry Nicholson's got a really awesome Lymphatic Mojo webinar, I suppose it is, that you can purchase on his website, and I got that a while back, and I'll tell you what, that's a game changer. If your lymph is really blocked up, it's going to take some time to shift it, so you're going to have to be patient. You're going to have to trust me that this stuff works. I did a lymphatic drainage on my aunt's dog when I was in Perth because I could feel around his neck and the back of his head and his chest and his armpits was ridiculously swollen, so swollen, and his movement was really poor. He'd had an ACL repair on his back leg months before, and he'd had a slip on the tiles that day, and he was in so much pain. And he's quite a big dog, and I didn't want to be touching around his knee because I don't know him well, so I did a lymphatic drainage around his head and his chest, and within an extremely short period of time, he got up and hello Tom, he got up and was walking so much freer and much happier, wanting to get involved in life again because he was hiding himself away because he was feeling sorry for himself. And over the next few days, I mean, I did it once or twice more, and over the next few days, this was a completely different dog. He couldn't get up. He was like obviously visibly in a lot of pain, and just doing a lymph flush through, because it all gets blocked up through and backlogged through the neck. So if you're not going to clear it through there, then the whole system gets blocked. And lymphs are, I've done quite a bit of research into it myself. Lymphatic is quite tough tissue. It's got a lot of collagen in it, and it's designed not to stretch really. And inside the little lymph nodes, there's what do we call this? Oh, I've lost reticular tissue, I think it's called. I've lost my brain for a second. Come on, I need my disc to get working again. Anyway, it's kind of like having cotton fibers in through these lymph nodes, and they have macrophages, which are cleanup cells or whatever, to break down all the gunk and the bacteria that we collect in our system. And if they get blocked up, they'll get really swollen and taut and painful. And so again, if you don't clear around the left side of the neck in particular, 3/4 of the body pretty much drains in through the subclavian vein on the left side. So if you don't clear that, it doesn't matter what you're going to do. You could do anything locally. If you get a swollen ankle and you try to get this inflammation and swelling out of that, well, it might go temporarily, but it will keep being a chronic swelling problem because you're probably blocked up in the neck. So, all my therapist colleagues out there, do some lymph work with your patients because it's I've seen some things that I shouldn't see happen with it, seriously. And the second thing is, if you're not an SFMA, what are you waiting for? Seriously. NKT is another game changer as well. All right, my babe, I see you. Say hi to Lulu. My man Pasquale is picking up our girl Laura. She's just returning back from Perth today, so he's just at the airport telling me he's got to go. Anyhow, what was I talking about? Yeah, NKT, SFMA, just absolutely game changing, and then being able to have this therapy now, this ANF, aminobiofrequency. I can do treatments on patients, and you'll see changes within seconds, and then they can go home and leave that. So it's kind of like wearable therapy. So it just keeps doing its thing. And then if they can't get back to see you, you can give them discs they can replace, because they can stay on for 72 hours. As soon as you take them off, they start their charge stays, it holds, so they can put it back on. So it's an accumulative amount of 72 hours. But if they don't drink water, it's not going to work. And that just makes total sense, doesn't it? Because everything we do at a cellular level requires water for a cell process, and it's all about energy transfer. And eventually you won't need to be wearing the discs. And some people, one session's all they need. Other people, it might take a few months, especially if they've got some chronic systemic inflammation going. But I'm telling you, if you've got anxiety, depression, Cuzzy bro just joined in. Hey, Ben. I was just talking about Frankie and his ACL issue and how I did a lymphatic drainage. It all ties into why I'm here in New Jersey and what have you. Yeah, so if you've got musculoskeletal issues, chronic problems, fibromyalgia, gut issues, anxiety, depression, any of that stuff, like, seriously, this is one of the coolest things I've seen. And like I said, I got a nose for this kind of thing. So if you're interested in it and want to hit me up for a bit of a coffee when I get back, if you're in Auckland or over Skype or anything, physio peeps, I'm always keen to share the love. So I'm out of here. Phew. And I'll update you tomorrow, because next level, man. Next level is like neck level, right? Oh, one more thing. No, it's not relevant, actually. Jay, how's your study going anyway? I know you're an Otago, you spaz. Is it going all right? Going good? Lenny, babe. Oh, I know I miss you. One of these days, girl. Seriously, we're going to have to catch up. But yeah, come a long way, huh? And I love coming to courses like this when you... oh, cool, Jay. I love coming to courses like this because it really invigorates and charges my passion for what I do, and constantly wanting to find more. And you know, one of my team members said to me the other day, she said, Gemma, you taught me to believe, to believe in physiotherapy. Or I can't remember how the comment went, something like that. And I said, no. I said, I believe in the human body's ability to just be amazing, and its capabilities of being able to self-heal and to optimize. And so, you know, if you're not feeling as good as you should, man, you got to start listening to that kind of stuff, because we are designed to feel a shitload better than that. Yeah, Jay. Yeah, I know, Lynn. Not much has changed. Anyway, hey, love you guys, and thanks for checking in. It's really cool. Otherwise, I'm just talking to a phone. I mean, live videos normally kind of wig me out, but this has been a really cool experience. And like I said yesterday, I'm totally grateful to be here. It was one of those things that I was like, where's the nearest course? Get me on it. So can't wait to do level 2 tomorrow, and then hopefully at some point I'll be able to, the universe will work in my favor, and I'll be able to do level 3, 4, and go on and be a fully fledged practitioner. I think there's about 7 levels or something. It's pretty insane. Yeah, so I'll touch base with you tomorrow after I've got some more exciting stuff for those that are interested, of course. It's not everybody's cup of tea. Someone said that the other day. I was kind of going on about how I went to the bodies exhibit when I lived in the States, and actually I went 3 times, and I was going on about how amazing it was, and it was this and that, and they looked at me and they went, not my not my thing. And I was like, what? Is not everybody interested in this? Clearly not. Okay, gotta go. Love you all, and good luck, Jamie, for this semester coming, man. And definitely got to catch up when you're in Auckland. Hit me up. Love you. Mwah.